Hello, my name is Dave Hibbard, and today we'll be presenting an introduction on TBI, which is an acronym for traumatic brain injury. Were you aware that most falls that occur with the elderly result in a traumatic brain injury? Those 75 years or older have the highest rate or risk for ending up with a traumatic brain injury and are hospitalized or have the most increased numbers dealing with death. TBI has a vague description of what the definition can be. TBI is an acronym for traumatic brain injury, previously mentioned. It occurs when external force traumatically injures the brain. TBI can be classified based on severity and a mechanism of other features. Head injury usually refers to TBI, but is a border category because it can involve damage to other structures such as your scalp or your skull. It is important to know that the exact definition for TBI tends to vary according to specifications and or circumstances of the fall or injury. There are a number of different symptoms that you deal with when you have a TBI related injury. Headaches, confusion, dizziness, blurred vision, nausea or vomiting, slurred speech, and dilation of both pupils. The different risk factors that are involved with TBI can be somewhat mitigated, but can prove to be difficult. Adequate lighting or clearing pathways, trying to move that rug that you trip over all the time. History of falls, how many times that individual has fallen or how many times they stumble over the same object. Visual or hearing deficits, having problems seeing can prove to be a major factor. Age, confusion, impaired judgment, balance problems, medication and or alcohol use. Prevention is not always going to be easy. Some of the simplest things can prove to help, like moving that rug that you trip over a lot, or putting a lamp in the corner to try to light up the room so you're not hitting that same end table over and over again. One thing that I would like everybody to take away from this is that if you see the symptoms that relate to TBI, make sure that you don't treat it as a joke and you take it very seriously and try to get that individual the help that they're going to need right away. TBI is not something to mess with, and it can hurt you a lot faster than a lot of individuals think. So just try to remember those symptoms and take what you can from this presentation and try to involve it in your lives as well as others if you have elderly in the family.
Working in a nursing home, I have seen many patients that have experienced the effects of TBI. TBI symptoms can affect the human body not only physically but mentally as well. A person with TBI faces significant risk of damage to the pituitary gland, leading to elevated risks of diabetes and hypopituitarism. Hypopituitarism is a condition of the pituitary gland when it does not produce normal amounts of some or all of its hormones. Other symptoms of TBI, such as headache, fatigue, anxiety, concentration difficulties, and irritability, are often confused with everyday stress. Another symptom of a TBI is depression. Diminished emotional functioning after TBI can create physical and cognitive difficulties. The development of depression after TBI is challenging for the individual, including poor psychological functioning, increased difficulties with communicating, and a diminished quality of life. Depression after TBI is associated with poor rehabilitation outcomes. Due to today's knowledge of TBIs, there are tests to determine if an individual in fact has a TBI. Patients suffering TBI are typically brought to a hospital emergency room for initial diagnosis and treatment. Once vital signs are assessed and stabilized, and other life-threatening injuries are identified and treated, the process of diagnosing the extent of the brain injury begins. Complete neurological evaluation is performed to rule out conditions requiring neurosurgical attention, such as hematomas, depressed skull fractures, and elevated intracranial pressure. X-rays, CT scans, or MRI scans may be performed to determine if bones of the skull are fractured and if bone fragments are penetrated with brain tissue. The patient may be presented with a series of questions. What is your name? Where are you? What day is it? And given simple commands: wiggle your toes, hold up 2 fingers. To determine if he or she can open her eyes, move, speak, and understand what is happening around them. If possible, detailed medical history performed to identify any previous injuries that exist. Seizures, disorders, including disabilities, prior psychiatric or psychological treatment, and or substance abuse. Patient's degree of consciousness is assessed to determine the severity of brain injury, predict her chances or his chances of recovery. To do this, physicians typically use the Glasgow Coma Scale, which measures the patient's ability to open their eyes, move, and speak. The more severe the injury, the lower the total scale, suggesting little chance for complete recovery. Total scores of 8 or below indicate a true coma and severe brain injury. Scores of 9 to 12 suggest moderate brain injury. Scores of 13 and above indicate mild brain injury. However, severity of the brain injury is not determined by GCS alone, and treatable conditions such as infection and dehydration may lower the GCS score. Now Sharon will discuss treatments and rehabilitation to aid in the recovery process of brain injuries.
After diagnosis of a brain injury, immediate steps are taken to stabilize the patient. These may include ensuring oxygen supply and blood flow to the brain and body while controlling blood pressure, minimizing secondary damage due to inflammation and bleeding, stabilizing the airway using oxygen or a ventilator to assist with breathing, use of hypothermia to lower body temperature to improve healing and outcome after brain injury, medications that stabilize and limit secondary damage after an injury include diuretics, which reduce fluid in tissues and increase urine output. They also reduce pressure inside the brain. Anti-seizure drugs are used to avoid brain damage caused by seizures, since moderate to severe traumatic brain injury patients are at higher risk of having seizures. Coma-inducing drugs are sometimes used to induce a temporary coma, which is helpful because a comatose brain requires less oxygen to function. Antibiotics, Coumadin, and many other medications are used as needed for each patient. About 1/2 of severely head-injured patients require neurosurgery to resolve bleeding or remove hematomas, which are blood clots, that may put pressure on the brain and damage tissues, to repair skull fractures or contusions, to remove pieces of skull in the brain, or to open a window in the skull to reduce intracranial pressure or provide room for swollen tissues. Elderly patients with significant brain injury require lengthy rehabilitation. Therapy follows a team approach to meet the complex needs of the person recovering from brain injury. The team may include the following: occupational therapist helps the patient relearn or improve basic living skills such as personal grooming and dressing. Physical therapist helps with mobility, impaired gait, balance, and walking. Speech and language pathologists help improve communication skills and strengthen swallowing reflex. Respiratory therapist helps wean the patient off the ventilator. Psychologist or psychiatrist helps with depression, cognitive status, managing behaviors, and coping strategies. Social worker or case manager assists with care decisions and planning and communicates with care providers and family members alike. Neurologists, doctors, and nurses provide ongoing care and medical services. The goals of rehabilitation are to help the patient relearn basic skills and improve abilities to function at home, and to ensure a return to as normal and independent life as possible. Now that we have learned more about traumatic brain injury and the lengthy recovery process for the elderly, let's look at some practical ways to prevent falls.
After learning more about traumatic brain injury and the lengthy recovery process for the elderly, let's look at some proven interventions that can prevent falls. First of all, encouraging exercise not only keeps the leg muscles strong, but helps improve balance and coordination. Lack of exercise can lead to weakness and increase the chances of having a fall. Health professionals recommend starting a regular exercise routine of any kind, even if it is only a few steps a day. Exercise can make you more responsive and help you react more safely to potential dangers or obstacles in your path. It has been reported that half of all falls happen inside the home. So it is very important to do a home safety checklist to eliminate these fall hazards. Removing clutter, such as throw rugs, making sure that there is sufficient lighting, adding grab bars inside or outside the tub or shower area and along or next to the toilet is all recommended ways to prevent a fall. Another area to consider is medications or a combination of medications that you might be on. These can have side effects such as drowsiness or dizziness. Having your doctor or your pharmacist review your medications is important to reduce the chance of risky side effects and drug interactions. Another way to prevent falls is to make sure your vision is the best that it can be. You can do this by keeping up with your yearly checkups. Poor vision can make it hard to get around safely. If you wear glasses, having your prescription strength checked when necessary will keep you seeing more clearly. After covering many elements of traumatic brain injury, you are now more informed as to what traumatic brain injuries are, what the symptoms are, and the diagnosis, which are the leading causes of brain injuries to the elderly. Falls contributing to traumatic brain injuries are a special health concern for our older adults. Since traumatic brain injuries cannot be cured, it is important to encourage our older adults to exercise and incorporate some of these suggestions for making the home safer to reduce the chances of falling. By doing so, we can help our senior citizens live longer and healthier lives.